Welcome to Cancers 101, where we break down the science, challenges, and breakthroughs in cancer research and treatment. I'm your host, Rittika, and today we have an exciting and important topic to discuss: the gut microbiome, cancer, infections, three elements that are more intertwined than we might ever expect. I'm joined by my brilliant guest, Aditi, who is here to help us understand the connection and the latest research.
Hi Rittika, I'm so excited to be here. Let's dive into this topic. The gut microbiome is such a crucial player in cancer treatment, and we are learning more about how disruptions in the microbiome can lead to infections and even impact cancer progression. It's going to be a great conversation.
Let's start with the basics. Picture your gut as a bustling city where billions of bacteria, fungi, and other microorganisms live and work together in harmony. The city is constantly working to maintain balance, but when external forces like chemotherapy, antibiotics come into play, it's like a natural disaster hitting the city, throwing everything into chaos.
Exactly. Chemotherapy is designed to target rapidly dividing cells, which of course includes cancer cells, but it's also impact healthy cells, especially those in the digestive tract. This damage creates an opportunity for harmful bacteria to take over, causing that we call dysbiosis, an imbalance in gut microbiome.
And this biosis doesn't just disrupt digestion, it can have far-reaching effects on immune system. When the gut's protective bacteria are weakened, it leaves the body vulnerable to infections, which is particularly dangerous for cancer patients who are already immunocompromised due to the treatment regimes.
Let's zero in on one infection that's particularly problematic in this scenario: Clostridium difficile or C. difficile. This bacterium is known for causing gut infections, especially after antibiotics have wiped out the good bacteria in the gut. And the trouble with C. difficile is that it can easily colonize the gut when the protective bacteria are gone.
Right. C. difficile is a big concern in cancer patients, especially after rounds of antibiotic or chemotherapy. These infections can range from mild to severe, with symptoms like diarrhea, fever, and even life threatening conditions like colitis. But the implications don't just stop there. Research shows that infections can actually fuel cancer progression.
That's an important point. The inflammation caused by the infections like C. difficile can promote an environment that supports tumor growth. So the gut's role in cancer goes beyond just digestion. It can actually influence the cancer's progression. It's like the infection sets the stage for cancer to thrive.
Given all the risks associated with dysbiosis and infections, the natural question is how can we restore balance and reduce these risks? One promising solution is fecal microbiota transplantation or FMT. This procedure involves transferring stools from healthy donors into the gut of patients to repopulate the gut with beneficial bacteria.
FMT has shown remarkable success in treating recurrent C. difficile infections, especially in cancer patients. By restoring a healthy balance of microbes, it helps the immune system recover, reducing infection risk, and even improving the patient's ability to tolerate treatments.
That's right. FMT is like rebuilding the city's infrastructure after a disaster. And there's also the option of probiotics, which are live beneficial bacteria that can be taken as supplements to help support the microbiome. While they might not have the immediate power of FMT, they can make a significant difference in improving gut health and reducing infections.
Let's take a closer look at a real-world case. Meet Sarah, a 45-year-old breast cancer patient undergoing chemotherapy. During her treatment, she developed a severe C. difficile infection. The infection was so bad that it delayed her chemotherapy, and she was feeling incredibly ill. Her doctors decided to try FMT to restore her gut health.
After the procedure, Sarah's C. difficile infection cleared up. Her gut microbiome started to rebalance. This has not only resolved the infection, but also helped her immune system recover enough to continue with her cancer treatment. It's a great example of how microbiome based interventions can make a tangible difference in the lives of cancer patients.
It's a powerful reminder of how interconnected our gut health is with overall health. By addressing the gut's bacterial ecosystem, we can make cancer treatments more effective and improve the patient's quality of life.
So, to summarize today's discussion, we have seen how cancer treatment, particularly chemotherapy and antibiotics, disrupt the gut microbiome, leading to dysbiosis and increasing the risk of infections like C. difficile. These infections not only complicate the situation but can also accelerate cancer progression. But there's hope in microbiome based intervention, such as fecal microbiota transplantation and probiotics, which can help restore balance and boost immune function.
The gut plays a crucial role in cancer treatment and recovery. By focusing on the microbiome, we could significantly improve patients' outcome and help manage infections that complicate cancer therapy. It's a fascinating and rapidly evolving area of research.
That's all for today for the episode of Cancers 101. A huge thanks to Aditi for joining me to break down this very important topic. We hope you found this discussion enlightening. If you have any thoughts or questions, feel free to reach out to us on our website.